Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, technology, and treatments. This is Rex on Call. Welcome to Rex on Call, live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today we're talking about gynecologic and prostate health. If you're watching us live and you have questions, they could be answered by our experts. The physicians taking your questions today are Dr. Kenneth Kim from UNC Gynecologic Oncology at Rex and Dr. Nathan Sheets from Rex UNC Radiation Oncology. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. Find us on Twitter and send us a message at RexHealthcare, #RexOnCall. One of the main advancements in fighting breast and gynecologic cancers is genetic testing. Knowledge is powerful, and the BRCA gene test uses DNA to help identify harmful mutations that put a woman at risk for developing these cancers. We spoke with one woman who's using that knowledge to save herself and hopefully others in her family.
It just took me a while to get my mind wrapped around, okay, I'm going to be dealing with cancer.
Frightened but strong, Pamela Toms faced breast cancer head-on when she was diagnosed in January. Cancer is prevalent in her family. Her father died of cancer when she was just 10.
I had an aunt later who died of breast cancer. Then my sister, when she was 33 years old, died of breast cancer.
With the guidance of Rex oncologist Dr. Lola Elijahday, Pamela made a courageous decision, and it began with genetic testing.
We're looking for specific high-risk genes that we know may increase the chances of getting specific cancers.
Family history plays a huge role in determining if a woman is at risk, including the types of cancer that run in the family, the age they were diagnosed, but also how many close relatives did not have cancer. The blood test determined Pamela was positive for the inherited gene mutation. For a woman who is at risk, the next course of prevention should be carefully planned out.
A woman who is identified to have an increased risk of breast cancer would be recommended to have a yearly mammogram and a yearly breast MRI. Breast MRIs are not typically recommended for an average risk woman. Some women at increased risk may decide the screening approach is not for them, and those are the women that may choose the prophylactic mastectomies route.
For Pamela, who's at high risk, a double mastectomy and removing both ovaries will hopefully prevent an occurrence.
With ovarian cancer risk, there really is not a good test to detect early ovarian cancer development, and so generally with people that have the BRCA mutation, we do recommend after they've had their children that both ovaries be removed along with the uterus.
Pamela says she's now telling other women in her family to get tested and screened for a chance at a longer life.
It exists, whether you test for it or not. I think it's better to know.
It's good advice because just getting tested can be frightening. So how often are the results positive? About 5 to 10% of the time. Pamela is planning to have another surgery to remove her ovaries and fallopian tubes as preventive steps. Now joining us are Dr. Kenneth Kim and Dr. Nathan Sheets. Thank you for coming and joining us today. Dr. Kim, is this a typical path for a patient who has had breast cancer and then tests positive for the BRCA gene to have removal of the ovaries and fallopian tubes?
Yeah, this is a very common way for this to occur. Breast cancer is much more prevalent than ovary cancer, and so there's a lot more patients that have that at a young age and then get tested for BRCA, test positive, and then get their tubes and ovaries addressed. We are seeing now that technology is advanced and we're identifying these people since the BRCA testing has come about, that now we're getting family members, daughters, really young women now in their 20s who have a positive test because they had an aunt or a mother who had tested positive, and they're coming at a now younger age to get in early to see what their options are and what their risks are much earlier than we had seen before.
And of course, that could lead into a whole new set of questions, because if they haven't had children yet, then you have to make some very clear decisions.
Yes, absolutely. That's the biggest issue with obviously this cancer and any cancer at a young age, but particularly BRCA, because it affects the tubes and ovaries and fertility, a big impact on fertility. So all these things are taken into account, and so a lot of these decisions are personalized and individualized based on their status, their fertility desires, their family status, things like that.
Yeah, very specific things. Dr. Sheets, let's talk about the PSA test. There's a lot of controversy, and you read many different things about the PSA test for prostate cancer. It used to be that was what men did, right? So what is going on with that?
That's right. Well, there's been a big pushback recently against screening in general and PSA testing in particular. And that's probably because we went a little bit overboard with things in the past. But what we're finding out now is that we just need to test smarter and not just rampantly test, but use the PSA in a smarter way, meaning looking at an initial value at age 50 perhaps, seeing what that is, and then testing in the future based on that initial value, as opposed to just throwing out the PSA test completely. There are several different recommendations out there, and they're conflicting, but my personal opinion is that any man should have a discussion with their doctor, at least at age 50, about whether or not it's right for them to be tested.
Would it be recommended maybe get a baseline test at 50 just to see where he might stand?
In my opinion, that's a good way to go. There are several different national organizations that have differing recommendations.
Okay, all right. So talk to your doctor to discuss what's best.
That's right.
Dr. Kim, let's talk more about the BRCA test, because when preparing for this show, I saw that there's multiple ones. It's not just one. Is that correct?
There are two BRCA genes, 1 and 2.
Okay.
And if you undergo genetic testing, it won't be necessarily a yes or no. Yes, you have BRCA 1 or 2 or no. Sometimes they can identify some potential deleterious mutations that may have some significance, but that we just don't know enough about. So undergoing genetic testing in the right person after undergoing genetic counseling under the care of a physician is good, but will also help with kind of deciphering and identifying and understanding what the test results mean, because it's not always a simple yes or no.
Okay, good to know that it's not just definitive like that. Dr. Sheets, technology has really changed and advanced the way you care for your patients. Can you tell us about some of the advancements you've been able to take advantage of in caring for those men?
Sure. What I do in general is radiation therapy for prostate cancer and for a number of different cancers. In terms of prostate cancer, we've gotten better at refining the treatments to more directly target the prostate and minimize the amount of radiation that's going to the adjacent normal tissues like the bladder and the rectum. There's something called intensity modulated radiation therapy, which has allowed us to deliver higher doses of radiation to the prostate safely with actually decreased morbidity for patients. There's now evidence that doing very high doses of radiation that are very targeted to the prostate over just 4 or 5 treatments, as opposed to 8.5 weeks of treatment, may be effective for certain types of low-risk prostate cancer. And so we're making things more convenient while at the same time hopefully reducing the side effects and potentially increasing the cure rate.
Surgery, is that something that is a last step, or is that still a typical part of the protocol, or just depends on the case?
Absolutely. Surgery is still very much a good treatment for prostate cancer, especially in younger men, because radiation can have long-term side effects that don't manifest for 30 years, but so can surgery have long-term side effects. So it's an individualized decision for each patient, and it's good to get opinions from multiple physicians as well.
Okay, all right, thanks so much. Well, as we go to break, we wanted to give you some risk factors that could help you learn about the chances of getting various cancers, such as ovarian cancer. First of all, your age. The risk rises as you get older. Family history of cancer, especially ovarian, breast, or colorectal cancers. Your reproductive history, women who have had their first full-time pregnancy after the age of 35, or women who have never had a baby. And birth control. Women who have never used birth control pills are actually at higher risk. Well, we are back right after the break to answer your questions. Give us a call or send us an email. Welcome back. This is Rex on Call, live on WRAL, and today we're answering your questions on gynecologic and prostate health. If you have questions for our experts, just call now, 919-744-3876. To email your question to Rex on Call, just email us at rexoncall@rexhealth.com. So let's take some of these questions. John has called in. His father died from prostate cancer. He is 48 years old right now. What would be your screening recommendation for John?
So that depends a lot on the age at which his father was diagnosed and at what stage his father was diagnosed. But in general, for someone who's 48 years old, I think it's very reasonable to have a discussion at that point about getting an initial PSA test.
Okay. As well as the PSA test, there's also the physical test that could be performed as well.
Absolutely.
And is that at every annual visit?
So again, that depends a little bit on different recommendations, but I think that whenever you're getting a PSA test, it's very appropriate to do a rectal exam as well.
Okay, all right. Dr. Kim, let's talk about cervical cancer. This is the one cancer that we actually have a vaccine for, but there seems to be resistance.
Yes, there has been resistance with this vaccine because the majority of cervical cancer is caused by HPV, which is technically sexually transmitted. There's been a lot of controversy about this vaccine that's directed towards the virus. However, with this series of shots, like in the history of mankind, we've never really been able to tell anyone, we can give you a shot and you cannot get this cancer. Like it's beyond, it's a step ahead of screening, because screening is trying to find the disease at an early state or pre-disease state. This is ahead of the game with a lot of the childhood vaccines that happen, like to prevent, polio, smallpox, things like that. This is one where we have engineered that we can actually prevent cancer.
So there is this resistance, it appears. Is it because of the stigma of HPV being an STD, essentially?
It is definitely because of that stigma. And going forward, a lot of the literature and a lot of the research had been done in the GYN cancer realm. And when it came out, admittedly, not a lot of pediatricians probably knew about it or knew how to counsel their patients about it. And so the last couple years, there's been kind of a renewed emphasis for education of patients, education of the medical community, as well as the efficacy, since now there's a new vaccine that covers even more types of HPV that can prevent upwards of greater than 90% of cervical cancer strains.
Okay, all right. Let's talk about, Dr. Sheets, Rex UNC has treated more than 7,000 patients for prostate cancer. How does this vast experience help you as a physician with your current and future patients, having that in your back pocket?
Sure. Well, whenever we're talking about doing radiation for prostate cancer, we're talking about a whole team that's involved in that. We have a physics staff, a therapy staff, nursing staff, and so many of these folks have seen a little bit of everything throughout the years in terms of treatment, and that gives us a lot of experience in order to be able to deal with issues that come up that maybe folks who haven't seen 700 patients wouldn't be able to deal with.
Okay. Speaking of that collaborative care, that is really an earmark of being treated at Rex UNC, because you have this really vast team of people who help care for one patient. Would you agree?
Yeah, absolutely. We were just talking about it before the show, that the care that patients and people receive at Rex is, because of the collection of the specialists, is really second to none.
Yeah, so every piece of your journey to hopefully wellness, there's someone there for you.
Absolutely.
Okay. All right. Well, coming up, we're going to answer more of your questions. Just call 919-744-3876. And as we go to break, we wanted to talk about your risk for prostate cancer. Again, your risk rises quickly after the age of 50. Your race, if you're African American, you are at a higher risk as well. Also, your family history of prostate cancer, and a diet high in red meat and high-fat dairy products. These are things you should be aware of, and be sure to talk to your doctor about screening tests to measure your PSA levels that may detect breast cancer or prostate cancer. Welcome back to Rex on Call here live on WRAL. And to reach us at Rex on Call, you can just dial 919-744-3876 or email us your questions at rexoncall@rexhealth.com. Teresa from Durham wants to know, she had a hysterectomy 12 years ago. Does she still need to get pap smears?
So this depends on the reason for the hysterectomy and whether she's had a history of abnormal pap smears or cervical dysplasia, which is cervical precancer in the past, which her gynecologist can tell her and will know what part of the screening guidelines apply to her for her screening or whether she needs any more going forward or not.
Okay. William from Nash County, he's 46 years old, and he'd like to know what would be some typical signs or symptoms of prostate cancer. Dr. Sheets?
That's a great question. Prostate cancer is usually completely asymptomatic when it's first diagnosed, and that's why, in my mind, the PSA test can be very important for some men, because in addition to other newer screening tests that we can use in conjunction with that, that's often the way that we do diagnose prostate cancer. If you have blood in your urine or are having intense pain in the prostate area, those are very rare symptoms of advanced prostate cancer, but usually by the time you're having symptoms, the cancer is fairly advanced.
Okay. Annie from Smithfield says that she cannot get MRIs because she has a pacemaker, but is having pain in her abdomen. How would she be tested for example, possibly a GYN cancer with that in place?
First, if she's having any sort of pain, she should probably seek some sort of medical care to sort it out. And based on her history of the pain, characteristics of the pain, her medical history, and her physical exam, they can kind of figure out what it may or may not be attributed to. As far as getting tested for GYN cancers, the typical three, the common three that you hear about are ovarian or uterine or cervical. She can get a pelvic exam if her history warrants, and if her symptoms and her history are consistent with one of those, then her medical doctor will know how to sort that out.
Okay, I think we all Google a lot of things. When you have a pain, you put it into the search bar. And when you Google things for ovarian cancer or some of these GYN cancers, it could be any number of things. Yes, I feel bloated. Well, is it because you ate too much? I mean, there's so many symptoms that could be other things too, right?
Yeah, absolutely. For ovary cancer, they actually call it the disease that whispers, because all those symptoms that people feel when they get ovary cancer, whether it's bloating or they get full faster when they eat, or they're having diarrhea or constipation or abdominal pain or any sort of nausea or discomfort, those are symptoms that some people feel from time to time, from day to day, depending on their GI or their situation. It's very difficult to discern a lot of those symptoms for ovary cancer, and a lot of times people don't realize that those symptoms have been occurring until they are already diagnosed with ovary cancer, and it's a later stage at that point.
Okay, things to keep in mind. Dr. Sheets, with prostate cancer, because of the PSA being a bit controversial, and when should you start getting these tests and how valid are there other screenings that men should consider?
There are a number of tests that can be used in conjunction with PSA, most of them using blood tests as well, in combination with other risk factors like age, for instance. And a number of these are available. Urologists are routinely using them now to help us better discriminate who is at risk for a positive biopsy and who really needs a biopsy. So I think if you're talking with someone about getting PSA testing, it's important that that person is aware that there are ways to better refine the PSA test at this point.
Okay, that's good to know. Well, we will have our final round of questions right after this break. This is Rex on Call, and as we go to break, here are cervical cancer risk factors to consider: human papillomavirus or HPV, You are more at risk if you have been infected. You're also more at risk if you have a family history of cervical cancer. Also, if your diet is low in fruits and vegetables, or if you have used birth control pills over a long period of time. Women 21 to 29 years old should be screened for cervical cancer every 3 years by having a Pap test, and women 30 and older should have a Pap once every 5 years. And welcome back to the show. This is Rex on Call, and we're taking your final round of questions right now. I'd like to ask both of you to address the fertility preservation issue. If someone were to get either a GYN cancer or prostate cancer, let's talk about particularly for younger women who are diagnosed with a GYN cancer.
This is a big topic because, in particular, our cancers directly affect the fertility organs. So especially when a patient comes in and they're younger, or they haven't had kids, or they're kind of planning their family, there are actually now a lot of resources and a lot of technologies that are available to them. And if a young person were to come in of childbearing age, fertility is an issue, a lot of times consultation with a reproductive endocrinologist, infertility specialist will be part of the plan, just to make sure that we've addressed all those concerns, all those questions, and we've explored all the options and the technologies that are available to them.
So you guys definitely put that in as a part of the protocol. You've pumped the
Absolutely.
brakes and said, hold on, let's see what we can do for you in this area.
Absolutely.
Okay. What about you, Dr. Sheets, if you have a young man that's come in with some sort of cancer of the reproductive system?
Yeah, so it's a little bit less of an issue with
Yes.
prostate cancer simply because of the patient population, but there are folks that are still looking to have children, young men diagnosed with prostate cancer, and so we always talk about sperm banking in that case, because treatment of prostate cancer will invariably lead to infertility no matter what type of treatment you get. It's not 100%, but it's very high.
Okay, all right. Tanya from Durham has had an ovarian cyst removed. Does this mean she might be at risk for ovarian cancer?
So that also depends on the nature of the cyst. If there was, a benign tumor associated with a cyst, if it was just a simple cyst or a physiologic cyst, it all depends on the pathology from that cyst, as well as her family history and her personal history as well.
Okay, so a lot of different factors
Yeah.
going into that. Martha wants to know, her husband had prostate cancer. He had surgery, chemo, and radiation. He's having a lot of trouble with bladder control. Is there something that could help his lifestyle?
Yeah, so I would definitely encourage him to discuss that with his urologist, because there are a number of different options that may be available to him for anywhere from small operations to just exercises that can be done. And so that's an hour-long discussion, but there are definitely things that are possible.
All right, so Martha, definitely there is something that can be done. All right. Well, thank you so much, Dr. Kim and Dr. Sheets, for your time today. And as always, for you at home, consult with your physician about any health concerns. If you're looking for a doctor beyond today's show, or you need a direct referral, you can call Rex HealthNet. That's Rex's free telephone information service. The number's on your screen. It's 919-784-4490. Again, thanks to our experts and to our phone bank for taking today's calls. And you can join us Monday, October 19th, for our next Rex on Call. Our topic, beating breast cancer. You can email your questions ahead of time to rexoncall@rexhealth.com. We will see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
The coyote is an exclusive species, and a large pack is always at the Tractor Place.